The people who was giving Jamie CPR were screaming down the phone, you know, where is the ambulance? Why is it taking so long? They just waited and waited. I mean, even the police officer first on the scene was saying, where is it? Why is it taking so long? And it just didn't reach him, it was just too far away.
Jamie Rees was 18 and out with friends in Rugby on New Year's Eve when he collapsed with a cardiac arrest. He wasn't drunk and hadn't been taking drugs. This was a Category 1 incident, the most serious emergency. The target is an average 7-minute response time. It actually took 17 and a half. He died 4 days later.
We were told that there was 32 ambulances available after midnight on New Year's Day. Sadly, 17 of those were outside hospitals. The first minutes are the most crucial time, and getting oxygen and a defibrillator onto Jamie were so crucial. The people in the back of those ambulances, sadly, I don't know, the situation they were in, but had they been able to offload those patients quickly into A&E and they could have been getting the nursing care they needed, those ambulances would have been back out on the road and they would have been able to come back and see to Jamie and make sure he had that emergency care that he needed straight away.
West Midlands Ambulance Service says the night Jamie collapsed was very busy, with ambulances attending 5 other calls, but admitted long hospital handover delays impact our ability to get to patients quickly, which is why all NHS partners are working together to reduce them.
23 ambulances with patients.
It is a long-standing issue and the causes are many, but this year the hours wasted by ambulances waiting outside hospitals and not answering 999 calls has risen exponentially. Ambulances are meant to hand over patients to hospital within 15 minutes of arriving. But look at this graph. It shows the number of hours lost in waits over 2 hours long. The figures were slightly better in May, but between April last year and April of this year, there was a 4,000% increase in the number of hours lost. In recent months in the West Midlands and in ambulance trusts up and down the country, the alarm bells are ringing. For example, unpublished data seen by Newsnight shows West Midlands ambulances waiting outside hospitals for more than 38,000 hours last month. That's 6 times higher than in June 2019, before the pandemic. Newsnight approached every single ambulance trust in the UK asking for an interview. They all declined. So instead, we've been through their board minutes. These are the records of their internal meetings where they discuss this very problem, and their language is stark. In the southwest, papers show that ambulances had to wait outside hospitals waiting to discharge patients for 10,000 hours a week. And the board gets so worried, they call for military help. This is not acceptable, the board says. It's soul-destroying for the ambulance crews. In the West Midlands, it's an equally grim picture. Several patients waited over 19 hours to be handed over, the board said. Long patient waiting times are causing harm, including death. And get this for a warning, by the 17th of August, it may be impossible to respond to patients at all. Guided by unpublished handover delay data, Newsnight went to 6 of the hospitals with the longest delays. They all happen to be in the southwest or West Midlands. This is a snapshot on a random Monday in July. It's not official data, merely what our researchers recorded over a 12-hour period. At Royal Cornwall, an ambulance waiting 10.5 hours to hand over a patient, and 2 ambulances that arrived at 9:30 a.m. and were still waiting to leave when we stopped collecting data at 8 p.m. At one point in the afternoon, there were 25 ambulances waiting with patients in the back. That's 25 ambulances and crews not out on the road. At Worcestershire Royal, our observer was eventually ordered to leave and stop observations. But before they recorded 15 ambulances waiting, 1 for 4 hours. At Derriford Hospital in Plymouth, we saw an 11-hour wait. At points, there were as many as 20 ambulances waiting outside the hospital and in an overflow car park. At Bristol Royal and Royal Shrewsbury, we recorded 3-hour waits to hand over patients, and at Heartlands in Birmingham, the longest delay we saw was more than 5 hours. Newsnight spoke to all of the hospitals about what we saw. Spokespeople for each told us that the health service was experiencing unprecedented demand, that they were sorry for delays and were working hard on new initiatives to try to improve things.
Why won't the hospital?
So what is happening? We heard from many ambulance staff and all painted a similar picture. Brendan is a paramedic who's worked in the ambulance service for over a decade. We've hidden his identity and changed his name.
I think the hospitals tolerate it because, if I'm honest, whilst we're there, we're not taking them more patients, and they see it as an ambulance problem rather than a hospital problem. But something needs to be done to free up the ambulance service, to allow them to get back on the road where they operate and deal with the patients in the community that haven't had any assessment.
So it's partly they don't want you going out there and bringing them more people?
I think some of it is, yeah.
That's extraordinary, isn't it?
Yeah, it is, and you wouldn't expect that. I've had nurses say to me, senior sisters say to me, if we let you go, you'll just bring us more. Why do you bring us patients? Well, we bring you patients because we're an ambulance service and you're a hospital.
And those are people who may be in dire need of an ambulance?
Absolutely, yeah.
And what does that make you feel?
Awful. I would be wrong to say that there are times when I haven't shed a tear for people we haven't been able to help because it's been too late.
But those who represent emergency doctors say there are no easy solutions. They can't admit more ill people, they say, because they can't discharge thousands of recovering patients into social care.
The basic contract between somebody becoming unwell and needing an ambulance is broken. The problem is that we can't just open them up and into a corridor in an emergency department where there isn't space. The corridors in emergency departments are frequently full anyway, so just offloading an ambulance into an area inside an emergency department, all you're doing is transferring one problem into another. What's better is if we can discharge patients from hospital, create that space so we unblock our emergency departments and allow ambulances to hand over their patients seamlessly.
But whatever the cause, the impact is clear.
People are dying pre-hospitally because of a lack of ambulance resources.
Is this a lack of joined-up thinking in the health service, or is it simply there isn't the capacity?
I think it's both. There isn't the capacity in some hospitals. There isn't the clinical staff available to sort of push patients through quick enough. And there's also it's your problem, not our problem, from some healthcare trusts.
And what about money? I mean, that's the cause of many of the health services problems we hear. A lot of politicians say the answer is just more money. Is that what we're talking about here?
Do you know, I don't think we do need more money. I think the money needs to be spent more responsibly.
Could the ambulance service that you work in collapse? Do you think to the point where, you know, people ring up, they just say, look, we can't help you, sorry?
We're doing that now. Yeah, we're kind of right on the fringe of that now, where people are phoning up and being told that they're not going to get an ambulance for 6 or 9 hours. And that's happening routinely, it's not just one-offs.
In Rugby, Jamie's mum, Naomi, is still pushing for more ambulances, more locally based. But a hard-won meeting with the Health Secretary is in doubt now after the recent Cabinet resignations.
We're back at square one because Sajid Javid has now resigned. You know, it's so deflating after we've worked for the last 6 months to try and arrange this meeting with the Health Secretary. We're having these installed across Rugby, we've been raising money.
Until those ambulances arrive, Naomi and Jamie's dad, Gavin, are raising funds for defibrillators. This one is at Jamie's old school.
His legacy is going to be that these end up everywhere, and eventually that we will get the ambulances back, we will get an A&E department back, and Jamie will carry on saving lives.
Everyone we've spoken to thinks things are getting worse, with, we were warned, some services possibly weeks away from total collapse. The UK government says the NHS in England has been given £150 million in extra funding to address pressures on ambulance services. But restoring trust in emergency care is, it seems, beyond anyone's capabilities right now.